Majority of women struggle with menstrual cramps, and in some women the pain can be so severe or extreme that it interferes with their daily routine. So in this video we are going to talk about what all precautions we can take in order to ease menstrual cramps. Now, during menstrual periods, your uterus contracts to help expel or shed its lining in a menstrual flow. Now, there's a hormone-like substance called prostaglandins which triggers uterine contractions, and as a result, we experience pain or cramps. Now, these menstrual cramps can happen with or without any underlying condition. Along with menstrual cramps, we might experience various other multitude of symptoms like constipation, diarrhea, bloating, nausea, headache, irritability, low back pain, etc. So basically, research has shown that women with dysmenorrhea, which is a medical term for painful periods, generally have high levels of prostaglandin. So basically, it's a hormone-like substance known to cause cramping abdominal pain. Now, this explains why non-steroidal anti-inflammatory drugs are helpful to ease cramps, because they act by blocking the production of prostaglandins, and as a result, it helps to ease the pain or cramps. However, these medications are not the solution in the long run, and they might create certain problems later on. So there are other vitamins and minerals that can be helpful to ease cramps. For example, magnesium. Magnesium has been scientifically studied to lower or ease menstrual cramps because they act by lowering the production of prostaglandins. So it's extremely helpful. I personally take it when I experience cramps. Number 2 is vitamin B1 and B6 are equally helpful to ease cramps, and also including making sure that your diet is rich in omega-3 fats. For example, fish oil can be extremely helpful to ease menstrual cramps because they actually act as an anti-inflammatory in your body. You can also use a heating pad. This heating pad works by relaxing the muscles around the uterus. As a result, it helps to ease the cramps. You can also consume foods rich in boron. Boron has been scientifically studied to reduce the severity and the duration of menstrual cramps. So basically, these are some of the precautions that you can take in order to ease cramps. However, if your symptoms are getting worse, or if you're experiencing cramps along with any abnormal symptoms like prolonged excessive bleeding, passing huge blood clots, pain during sexual intercourse, fertility issues, pain during urination or bowel movements, any sort of abnormal symptoms if you experience along with cramps, I suggest you to go see your gynecologist as soon as possible to identify the underlying condition, because these abnormal symptoms or cramps can sometimes be a result of your underlying conditions. For example, endometriosis. So basically, it's a condition in which the tissue that normally lines the uterus grows outside the uterus, which can trigger various complications and abnormal symptoms. It could also be fibroids. So fibroids is basically the abnormal growths in the uterus, or it could be pelvic inflammatory disease, which is basically an infection of the reproductive organs. So it could be because of any sort of an underlying condition. So it's important to get the right diagnosis and take early precautions. So I hope this video was helpful, and make sure to share this with all your friends and family who might benefit from this information. And I'll see you in the next video.